know that the province of Ontario informed the Public Health Agency of Canada that they had a case of the novel coronavirus. The patient, who had recently returned from Wuhan, China, is isolated and under care. And pending confirmation by Canada's National Microbiology Laboratory, which is expected to complete the testing within the next 24 hours, this represents the first case of novel coronavirus in Canada. We're working actively to limit the spread of the virus. I've been communicating with my colleague, Minister Elliott from Ontario, as well as my other counterparts across the country. Nous sommes au travail pour faire face à ces virus. As a country, we've learned a lot since the SARS outbreak in 2003, and this has allowed our country and all levels of government to work very closely together to ensure that we are prepared. We're prepared to identify cases and to respond to protect the health of Canadians. All health ministers from across the country have been working extremely closely and very well together. Since China first reported cases of the novel coronavirus in late December, the Government of Canada has been working extremely closely with our provincial and territorial counterparts and international partners like the World Health Organization. This has included exchanging information and updates on a daily basis, and we've been preparing to limit the spread of the virus in Canada. Canadian hospitals have an incredibly strong infection prevention and control system and procedures in place to manage situations exactly like this. We've also put into place measures at the Toronto, Montreal, and Vancouver international airports, reminding travelers to inform a border services officer if they're experiencing flu-like symptoms. While we are prepared, I can assure Canadians that monitoring the situation is a priority. Suivre cette situation est ma priorité. While the risk of an outbreak of novel coronavirus in Canada remains low, I encourage Canadians to tell your healthcare professional if you've traveled to an affected area of China and developed flu-like symptoms. And I'll now turn to Dr. Tam for comments.
Thank you, Minister, and good morning, everyone. I'd like to start by saying that yesterday's announcement by the province of Ontario of a case of the novel coronavirus in Canada was not unexpected. The health system is on alert to detect potential cases and to respond promptly when they are confirmed. It shows that our systems are working. I want to impress upon everyone that although we now have a case in Canada, the risk to Canadians remains low. We are aware that the number of cases are increasing in China, but there are very few exported cases. Person-to-person spread has been reported in close contacts. Since the start of this outbreak, I have been in close contact with all the provincial and territorial chief medical officers of health. I would like to thank Ontario for rapidly communicating the first case in Canada. The province has indicated that the patient has been managed with all appropriate infection and prevention control protocols, so the risk of onward spread in Canada is low. Nevertheless, it would not be unexpected that there will be more cases imported into Canada in the near term, given global travel patterns. Canada's disease prevention control systems are designed to quickly detect and contain infectious diseases. This case demonstrates how our health system is able to detect, diagnose, and appropriately manage cases. Based on the latest information, the patient had symptoms on the plane. Therefore, the Public Health Agency of Canada is assisting Ontario health authorities with plane contact tracing. The agency's National Microbiology Laboratory has developed the diagnostic test for the novel coronavirus and has been collaborating with provincial laboratories to expand testing capacity across Canada. Public Health Ontario now has the capacity to test for the novel coronavirus. A sample is being sent to the National Microbiology Laboratory as Canada's reference laboratory for further confirmation. Globally, there is a significant and unprecedented effort underway to contain the spread of this virus, and Canada is an integral part of that global effort. Travelers should always take precautions against respiratory and other illnesses while traveling and seek medical attention if they become sick. It is very important for anyone who becomes ill after travel to tell the healthcare provider, including paramedics, ahead of time if they have traveled to an affected area of China and have flu-like symptoms. The general public and health providers can find more information about this novel virus online at canada.ca/coronavirus, including steps that they can take to protect themselves from infectious diseases. The Public Health Agency of Canada will continue to collaborate with public health authorities and international partners to limit the spread of novel coronavirus in Canada, and we will keep Canadians informed as new information becomes available. Thank you.
Bonjour, je suis le Dr Hajdu, sous-administrateur en chef de la santé publique du Canada. Je voudrais commencer par dire que l'annonce faite hier par la province de l'Ontario d'un cas de ce nouveau coronavirus au Canada n'était pas inattendue. Le système de santé est à l'affût des cas potentiels et est en alerte pour réagir rapidement lorsqu'ils sont confirmés. Cela montre que nos systèmes fonctionnent. Je tiens également à faire comprendre à tout le monde que, même si nous avons maintenant un cas au Canada, le risque pour les Canadiens demeure faible. La situation en Chine continue à évoluer et le nombre de cas continue à monter. Mais les autorités en Chine ont mis des mesures pour empêcher la transmission de ce virus. De plus, l'exploitation des cas à travers le monde, le nombre est faible. Et finalement, la transmission de ce virus exige un contact étroit. Depuis le début de cette éclosion, je suis en contact étroit avec tous les médecins hygiénistes en chef des provinces et territoires. Je tiens à remercier l'Ontario d'avoir rapidement communiqué ce premier cas au Canada. La province a indiqué que la prise en charge du patient est conforme à toutes les procédures de contrôle et de prévention de l'infection, de sorte que le risque de propagation au Canada est faible. Néanmoins, il ne serait pas étonnant que d'autres cas soient signalés au Canada à court terme compte tenu des habitudes de déplacement dans le monde. Les systèmes canadiens de prévention et de contrôle des maladies sont conçus pour détecter et contenir rapidement les maladies infectieuses. Ce cas montre comment notre système de santé est capable de détecter, de diagnostiquer et de gérer les cas de manière adéquate. Depuis hier, on a reçu d'autres renseignements qui indiquent que le cas était symptomatique pendant le vol de la Chine au Canada. De suite, l'agence est en train d'assister les autorités de l'Ontario avec le suivi des autres passagers qui étaient en contact étroit avec le cas. Le Laboratoire national de microbiologie de l'Agence de la santé publique du Canada a mis au point le test diagnostic pour le nouveau coronavirus et collabore avec les laboratoires provinciaux pour étendre la capacité d'analyse à tout le pays. Santé publique Ontario est maintenant en mesure d'effectuer des tests de dépistage du nouveau coronavirus, mais un échantillon doit être envoyé au Laboratoire national de microbiologie, le laboratoire de référence du Canada, à des fins de confirmation additionnelle. À l'échelle mondiale, un effort important et sans précédent est en cours pour contenir la propagation de ce virus et le Canada joue un rôle actif dans cet effort mondial. Les voyageurs doivent toujours prendre des précautions contre les maladies respiratoires et les autres maladies pendant leur voyage et ils doivent consulter un médecin s'ils tombent malades. Il est très important que toute personne qui tombe malade après un voyage informe à l'avance son fournisseur de soins de santé, y compris les ambulanciers, si elle a voyagé dans l'une des régions de Chine qui sont touchées et présentent des symptômes de type grippal. Les membres du grand public et les fournisseurs de soins de santé peuvent trouver plus d'informations sur le nouveau coronavirus 2019 en ligne à l'adresse canada.ca/le-coronavirus, notamment sur les mesures qu'ils peuvent prendre pour se protéger contre les maladies infectieuses. L'Agence de la santé publique du Canada continuera à collaborer avec les autorités de santé publique et les partenaires internationaux pour limiter la propagation du nouveau coronavirus au Canada. Nous tiendrons les Canadiens informés au fur et à mesure que les nouveaux renseignements seront disponibles. Merci.
Hi, Tom Perry with CBC News. You mentioned that the patient was showing symptoms aboard the plane. Did they report that when they arrived? And if so, why were they allowed to go home?
I think we've been working with the local public health authorities that have been interviewing the patient, really out of precautionary measures. This patient may have had some mild symptoms, certainly not something that would be particularly obvious, I think. But as you know, we have measures at the 3 international airports, including Toronto Pearson, which has a health screening question, which has instructions to travelers. So I think the right approach right now, out of all precautions, is to inform passengers that are in the close proximity of that particular patient. So we will be working very rapidly right now to do so.
But did this patient report they were experiencing symptoms when they landed, or did you only find out about that afterward?
This is just very current information that we obtained.
So you found that out today, or?
Essentially, yes, very, very recently.
Just so I'm clear, you didn't know when this person did not report when they landed that they were experiencing symptoms?
This patient was not reported to us, no.
So just to add to that, though, the patient, when he became ill, more ill, that he realized he needed medical support, in fact, followed all of the information provided at the airport. In fact, provided information to the first responders that he had recently returned from Wuhan. So the first responders were able to respond wearing protective gear and were able to alert the hospital to which he was being transported, Sunnybrook, that in fact the patient was indicating that he had returned from the area under question. So for me, that is a sign that the information at the border did actually percolate through to the patient and his family, and that in fact he provided appropriate information to his medical team, as it were.
Hi, it's Annie Bergeron-Oliver with CTV National News. Obviously, there's a lot about this virus that is still not understood, how it's transferred, for example, from person to person. But I'm sure there's a lot of people watching this who are worried that, Toronto Pearson is a big airport, that maybe they came into contact with this individual. I'm wondering if there's any more information you can provide about when this individual arrived at Toronto Pearson Airport and the flight path, that kind of thing.
So just to reiterate that based on the latest scientific data available, of course we're getting more, is that people transmit when they are in close contact, and particularly prolonged contact. So it's really fellow travelers or family members traveling with a patient that's at the highest risk. We will be providing information together with Toronto Public Health on those who are most at the immediate area of the passenger. And so that so we have protocols in place at airports should anyone get sick as well. What I like to emphasize is for other people on the flight or in the airport that are not in close contact with the patient, that they should not be overly concerned. If you were coming back from China, we have been providing information at the airports as to what you should do to monitor your own health, and should you become sick, to be able to provide that information to your healthcare providers. So those are the really very clear things that Canadians can do to protect themselves or after they return from China.
You also mentioned that it's not unlikely more confirmed cases will come to Canada. I'm wondering if you can go over the protocols that are in place and what additional measures PHAC is putting into place in preparation for additional cases.
So right at the start, when we heard about this particular virus, this novel virus, or pneumonias in China, we alerted the whole Canadian health system through the Chief Medical Officers of Health. And so one of the very key measures that they have put the front lines of the health system on alert. That is extremely key because they need to be able to ask the travel history and then symptoms and put anyone that is suspected to have the virus in immediate isolation and undergoing all infection prevention control measures. But as the minister said, that these are the basic foundational infection prevention control measures that are already in our hospital systems. So of course, we are providing information to travelers to the affected areas to ask them to take enhanced precautions in terms of health. And Canadians should also keep up to date in the Government of Canada website on travel warnings to the affected area as well for other safety security reasons, because of course China is taking extraordinary measures that meant certain flights are disrupted, etc. I've just said that we have enhanced measures now at the borders in terms of additional screening and providing the necessary information to travelers should they come back from the affected areas and get sick. And so I think those are the very important measures. And China provided the sequence of the virus very quickly. So we are now able to really detect this virus through our laboratory systems. And as we've seen, the capacity has increased in Canada. It's not just the National Microbiology Lab, it's other laboratories as well that's beginning to get this capacity in place. So I'm confident that we have the systems in place to rapidly detect and to prevent further spread. That is the key objective.
Ashley Burke, CBC News. Minister Hajdu and Dr. Tam, can you both individually paint a picture of what you're doing behind the scenes to make sure Canadians are safe, what types of meeting you're having, who they're with, what's being said?
Well, thank you. The first and I think most important meeting I have is with Dr. Tam on now pretty much a daily basis. We speak and I get a situational update in terms of what the situation is nationally and internationally, which is very helpful because then I am able to share that with my provincial and territorial partners as well. That communication is not one way. They are also sharing information, as we saw yesterday, but even more generally with us as they work through their own particular situations in their own provinces and territories. And I also am working very closely with my ministerial counterparts, Minister Blair, Minister Garneau, Minister Champagne, just to talk about our understanding and our protocols and to make sure that we have the pieces in place to continue to keep the risk low to Canadians. And I'll turn it to Dr. Tam for a more medical answer.
Yes, so just let me paint you a little picture. So when we received the intelligence about the cluster of pneumonia in Wuhan, we, of course, immediately pick up the phone and contact our World Health Organization colleagues, obtain more information, and we were maintaining constant linkages with the World Health Organization since then. We are also in close contact with other international partners, particularly the CDC, so that we can share information from each other as well. Domestically, we have now, since SARS, established the provincial, territorial, and federal governance in place that can be stood up very rapidly so that all chief medical officers are immediately on a teleconference, share information. We are developing protocols and guidelines, assist to try and standardize the response across the country as well, and make sure our surveillance systems and our laboratories are capacitated. So we've been meeting very regularly, and in the next coming week at least twice, but we can escalate as much as possible. We have activated our Emergency Operations Center at the Public Health Agency. That also allows us to connect with all the other federal government departments, which we have to work very closely together, including the Canadian Border Services Agency, Public Safety, and others. So there's many layers of connectivity that we're doing right now.
And can you as well both tell me, how are you going to manage the public's fear of coronavirus?
Well, I think it is very important to remind Canadians that the risk remains low for infection. So part of how we manage the public's fear is being available whenever necessary to answer questions that the public has, that the Canadian public has, to be transparent with the information, to share with Canadians what we know, to share with Canadians what we don't know as of yet, and to reassure Canadians that our systems are, just as Dr. Tam said, extremely well coordinated. I think that is an important thing for Canadians to remember, that we have had 17 years or so since the SARS outbreak that has allowed for us to have a much more collaborative, much more responsive system. And Dr. Tam's illustrated in her remarks just some of the mechanisms that have come into play since that time that allow us to be this responsive and this collaborative. She wants you to say it.
So I think, you know, yesterday was an incredible illustration of how this all works. So as soon as laboratory testing is available, we get a phone call from Ontario. We connect very, very rapidly, and they do that with the local public health units in the hospitals, and so that we can immediately respond at every level in a very coordinated way. We will also be expected to report any case in Canada to the World Health Organization so that they can keep track of the epidemiology and the data of the exportations. We will learn about this case and provide that information so that the global scientific community can learn from our experience as well.
Li Mingzhou, Newtown Dynasty TV. I understand the virus is spreading quickly in China. So after the lockdown of Wuhan city, when I was reading like the Chinese media, there's about another dozen cities, smaller cities being locked down. So I wonder whether our government has, you know, like is going to advise travel, you know, travel advisory, advise Canadians not to travel to the, you know, affected cities and, you know, like lockdown cities, and keep the list of lockdown cities updated, like very timely?
So the Government of Canada has provided travel advisories on our websites to travelers that are considering going to Wuhan or to China in general, providing information just as you've illustrated, what's happening in China, what they can do if they must travel to protect their own health, and also what to do when they return if in fact they are demonstrating any symptoms of illness. So just as you've suggested, that is exactly what the government is doing.
Thank you.
Hi, Stephanie Levitz, the Canadian Press. I wonder if you could just clarify for us this issue of tracing the passengers on the plane. Are you tracking down everyone who was on the plane, people who were sitting right next to the affected passenger, or what's happening with regards to that?
Yes, we have existing protocols in place based on the scientific information about coronaviruses. These are spread by droplets on the whole. So these land in a certain distance, if you like. And so in a plane contact tracing perspective, we're looking at a 2-meter radius. So of course, we'll be looking at the plane and its seating plan and where that patient was actually seated in order to trace the people who are surrounding, or the passengers surrounding that. The main focus, of course, is on the actual fellow travelers, because they have been in the most close and prolonged contact as well, or anyone who may have administered some sort of care to a passenger. And also informing the airlines and the airline staff who may have been serving that particular zone or cabin as well. And then for the rest of the plane, if you don't get a call from public health authorities, it means you were not right next to that 2-meter radius of that particular patient. And you should take the information that you would have received at the border from the Public Health Agency of Canada as to what you should do if you develop symptoms and you should get sick. You should sort of have any symptoms to call ahead to your health providers. So I think any other passengers should remain calm. You have the instructions to know what to do if you should get sick.
Just following up on the question of information, there's a lot of misinformation that is circulating online, both about the virus, about the Canadian government's response. I wonder if you're taking any proactive steps to deal with that, hunting it down on Facebook, Instagram, Twitter. And also, are you publishing all this information in more languages than just English and French? Have you done a concerted effort and outreach to the ethnic language media and Weibo and communities like that?
So Yes, it's unfortunate that misinformation is creating a perception for Canadians that belies the reality that the risk remains low. And misinformation is difficult to combat online, as we know. Certainly, we continue to make ourselves available to the media at any time, as evidenced by today, and ongoing. So we are trying to communicate as clearly, as transparently, and as frequently as requested and as needed. We will obviously commit to coming back to Canadians when information changes and when situations arise, as evidenced by yesterday's press conference from Ontario, our ability to be here today with you. And we make that commitment again to Canadians that we will continue to provide information as rapidly as we gain it. And finally, to your question about other language, yes, Dr. Tam has been doing interviews in other Chinese media outlets, as well as some of my colleagues, and we are providing information in other languages as well.
There appears to be some concern among some Chinese communities about the ongoing lunar festivals that are happening right now and whether or not they should continue, whether they should be canceled. What's your advice to those communities in light of what you know right now?
I reiterate that the risk is extremely low for Canadians, that there is no need for Canadians to be alarmed that they will contract the virus in a casual setting in a way that is easily done. So my advice to Canadians is to take normal precautions to protect their health. I can turn to Dr. Tam in a minute to reiterate what those are, but that the risk remains low and people should continue their lives. And we will, as I said, commit to Canadians to come back if information changes.
As the Minister said, the risk to Canada is low. Any imported cases, we will be rapidly preventing any further spread from that case. So I think any public gathering in Canada, as the Minister said, you exercise regular precautions. In the wintertime in Canada, there are other respiratory infections as well. So we absolutely advise people to do the usual things. Wash your hands. Don't cough towards someone, cough into a tissue or into your sleeve and discard the tissue properly. Stay home, you're sick. It doesn't help yourself or others if you go out and celebrate and mingle with others if you're sick. That's really, really key, and I think it's important for Canadians to understand that. And as with all infectious diseases, the health system is set up to reduce any sort of spread in those settings, and definitely call ahead to your health provider if you think you might be infectious to others. That's the best practice.
We have one more question in the room, and then we'll go to questions on the phone.
Hi, it's Annie Bergeron-Oliver again with CTV National News. The Americans are chartering a flight to get out diplomats, their families, and some U.S. citizens in Wuhan. I'm wondering if Canada is considering doing the same thing, and if you have any idea how many Canadian diplomats or Canadians are living there.
So I have been working closely with my counterpart, Minister Champagne, and his office has advised that anybody that needs consulate help to leave Wuhan or with any other matter related to family members that are there to reach out to the government, and we will provide assistance.
But chartering a plane, is that something that's being discussed at the moment?
At this point, it doesn't appear that we have the need to charter a plane, and I leave that to Minister Champagne's discretion about what measures need to take place. But certainly, if anyone has any concerns about someone that is in the region or needs support, to reach out to Global Affairs Canada, and we will provide them with that support.
We'll go to questions on the phone, please.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question is from Brian Meller from Yahoo. La première question vient de Brian Meller de Yahoo. Please go ahead. Votre ligne est ouverte.
Hi, thank you for taking the time this morning. I wanted to ask about the airplane screening procedures. I remember a couple of days ago you mentioned it was a 3-part procedure. I was wondering if these procedures have at all changed or will change in the upcoming days now that we have discovered a case in Toronto.
Our procedures stay the same. Just to reiterate, that's providing information on the arrival screens at Toronto, Vancouver, and Montreal to inform passengers to let a border service officer know if they are sick after traveling to the affected area. An extra health screening question at the electronic custom kiosks at those airports. And then the border service officers, being the first screening officers, if they identify anyone who is sick and has been to the affected area, will be contacted the public health agency staff for further measures. And so that remains the same, and you've seen how that's been working as well. And that first passenger was had the information that they need to know what to do after they entered Canada as well.
As a follow-up question, are these procedures the same for people coming in from any flight around the world, or is it only from the affected areas in China?
So the specific health screening question is focused currently on Wuhan, China, where that is the epicenter of this particular outbreak. We'll be evaluating that on an ongoing basis. And so we will be looking at the data as we speak and deciding whether an affected area needs to change at all. So that is an ongoing evolution, and for sure we'll be updating those kiosks when we deem that the data shows that that is needed.
Thank you.
The next question is from Sandro Contenta from the Toronto Star. La question suivante est de Sandro Contenta du Toronto Star. Please go ahead. La ligne est ouverte.
Yes, hello. It's a question for Dr. Tam. And forgive me, doctor, but you were asked this question already by the CBC, but I just need some clarification. You were asked whether whether the gentleman who seems to be infected reported to authorities at Pearson that he had been to Wuhan and that he had symptoms. I gathered from your answer that your information is that he did not report that. Is that correct?
Well, my information is that that person reported to local health authorities according to the information we provided at the airport. That is the information that I know.
So you don't know whether he reported at the airport or not?
He would have had
at the airport.
Well, anyone coming from the affected area would have had those screening questions. I can't comment in the exact details as to what happened to that person going through Pearson Airport, but just to reiterate that I think the system is working and that the person obviously got the information that they needed to enter the health system in a safe and responsible manner.
Thank you. The next question is from Jamie Moracher from Global National. La question suivante est de Jamie Moracher de Global National. Your line is now open. Votre ligne est ouverte.
Thank you so much. Hi, everybody. So just to follow up on that as well, we're essentially relying on people at the airport to admit that they're sick or, to know that their illness is in line with this coronavirus. But in this case, this person, we've said this before, did walk out of the airport. Is there any chance that you'll be considering either, a quarantine system to take people's temperature or a travel ban or something like that? Because we do know that there's going to be a rush of people coming back, especially from Lunar New Year.
So the system that we have in place is the one that we think would be the most effective. Certainly when a border service officer has a passenger that has reported symptoms and been to the affected area, they do refer to the quarantine service, who would then be able to do a secondary assessment and can send the patient also to the nearest emergency room to get checked out, including any kind of temperature check. Based on our experience, just doing temperature checks on every single person coming off a plane is not effective.
And any consideration to a potential travel ban?
So we also look towards the World Health Organization under the international health regulations, and there's no recommendations for travel bans. Instead, as you just, we reiterated that the Chinese government is taking extraordinary measures within its own borders, and we are providing information to travelers who are going there, as well as the returning travelers. From a public health perspective, public health action and measures perspective, those are the sort of more tried and true approaches to how you manage an outbreak of infectious disease that is elsewhere.
Okay, just one quick follow-up question. This is for the minister. Excuse me if this has been brought up. I'm kind of like losing cell service here and there. I know Annie kind of touched on it, but I didn't hear it get answered. There's only one flight basically a day coming from, that would have connected from Wuhan back to Toronto. I know there's no straight shot flight, but are we talking about the China Southern Airlines flight, that one flight a day? This is the flight that this gentleman was on?
So I'll just clarify. This is the China Southern Airlines flight. And the flight number we actually have, this is CZ311, is the flight from Guangzhou to Toronto that arrived.
Thank you very much.
Yeah.
Thank you. The next question is from Denise Paglinawan from Reuters. La question suivante est de Denise Paglinawan de Reuters.
Hi, yes, thank you. I'm just wondering if you have any updates on the family of the patient. Have they contracted the virus, or what's their situation right now?
Toronto Public Health is following very closely with the family members or any other close contacts, and they will be monitoring them for 14 days, which is the recommended period for monitoring. So there's only one case in Canada. We have not had any reports of anyone else who is a case. So that's information we have now. And I'm sure Toronto Public Health and Ontario will inform me if they are concerned about anyone. But just to say that if they were close contacts, they will already be managed and monitored by the local public health authorities.
Thank you.
Thank you. The next question is from Holly Carouk with CBC News Winnipeg. La question suivante est de Holly Carouk de CBC News Winnipeg.
Hi, yes, thank you. Just a question in regards to the pool of people on the plane that are determined to be in close contact with the patient. Where are we in the process of contacting those passengers, and do we know yet where they were going? And is it possible that they were going on to connecting flights, say, here in Manitoba or other provinces?
So that is part of normal plane contact tracing in terms of protocols. So the manifest is obtained, that is provided to the Ontario health authorities, and will assist them as needed. So if there were passengers within that 2-meter radius, they will be contacted no matter where they are in Canada.
But where are we in the process of that? Like, have all these passengers been contacted?
Right now, we're at the early stages of that process. So because it's done by, the contact tracing is done by local public health, we'll be working with them very closely just to execute that as fast as possible.
And just one quick question for clarity. I guess the sample that was sent to the National Microbiology Lab in Winnipeg, do we know the status of those results? And if not, when can we expect them?
I think we can expect them within the next 24 hours. That's what I've been told. And so just to reiterate that the Public Health Ontario test is a very good test, and the lab in Ontario had very close communication with the reference lab in the National Microbiology Lab in Winnipeg. So this is a double checking, if you like, given that the tests are new and this is a novel virus. But we do expect to get that test out, results out as soon as possible.
Okay, thank you.
Thank you. The next question is from Hélène Moka from La Presse Canadienne. La question suivante est de Hélène Moka de La Presse Canadienne.
Oui, bonjour. Peut-être que l'administrateur adjoint de la santé publique pourrait répondre à ma question en français. J'aimerais savoir les autres passagers qui ont voyagé dans l'avion, dans le même avion que la personne infectée. Est-ce qu'elles se trouvent maintenant dans d'autres provinces canadiennes? Savez-vous où elles sont?
Moi, je peux répondre. Maintenant, on est en train d'assister les autorités de la ville de Toronto, aussi Ontario. On a obtenu la liste des passagers et les autorités sont en train d'analyser la liste. On veut seulement cibler sur les passagers qui sont vraiment autour de cas qui étaient malades dans environ de 2 mètres. Après, on va contacter les personnes identifiées selon leur adresse. C'est possible que les autres personnes autour du cas résident dans les autres provinces et territoires. Et si c'est le cas, on va envoyer les renseignements pour les autorités dans les autres provinces et territoires selon le besoin.
Donc, ces autres passagers-là qui se trouvaient à 2 mètres de la personne qui a contracté le virus, est-ce qu'elles ont été testées ou vont-elles être testées?
Non, le protocole, normalement, c'est de suivre les patients avec une surveillance pour les symptômes pour les prochains 14 jours.
OK. Et quel est le risque de propagation à l'extérieur de Toronto, dans les autres provinces?
Je ne comprends pas exactement la question.
Est-ce qu'il y a un risque de propagation dans les autres provinces canadiennes, comme au Québec, par exemple?
Non, actuellement, on voit que le cas est déjà à l'hôpital, isolé. On prend toutes les précautions dans l'hôpital pour ne pas avoir d'autres transmissions. Pour les autres passagers dans le même vol que le cas, on estime que le risque de transmission est encore faible. C'est avec des bonnes précautions, on veut cibler, identifier les passagers autour du cas, pas moins ou jusqu'à 2 mètres de passagers, et on va donner les renseignements aux autorités dans les provinces et territoires au fur et à mesure pour faire le suivi, pour surveiller les contacts pour les prochains 14 jours.
OK, merci.
Merci. The next question is from Karen Pauls with CBC National News. La question suivante est de Karen Pauls de CBC National News.
Hello, thank you. We understand the National Microbiology Lab has coronaviruses like SARS and MERS, but they need samples from infected Wuhan patients to isolate and work on. Do you know when and how will the lab get that virus? And is anyone there currently working on a vaccine now?
So there is an international network of laboratories that do work together to share the latest information. What we have, which we didn't have during SARS, is the latest technologies, so that with the publication of the sequence of the virus by Chinese government and scientists, the laboratories, including the National Microbiology Lab, is able to look at that sequence and be able to construct the diagnostic molecular testing very, very rapidly. So that is the first step. There will be international collaborations on research and on vaccine development, and currently that is being coordinated by the World Health Organization. And you know, our laboratory can contribute or assist as needed. Right now, we are not the laboratory that is looking at a novel vaccine, but we will certainly be looking at how else we can help. Any Canadian researchers in this sphere, we will facilitate the connections to the World Health Organization's efforts.
Okay, and there's also lots of speculation online about whether this outbreak could be connected to the level 4 lab in Wuhan, and whether any work being done at our lab could be connected, because there are people going back and forth between the two labs. I'm wondering, what are you doing to find out more about any connections between the Wuhan lab and this outbreak and our lab and this outbreak, and what do you want to tell the public about that?
Well, as part of my close connection with the World Health Organization, the data that's provided, strongly suggests that the initial cases clustered around connection to a certain live animal market. So we have to really focus on the data that we know. And so I think that the global laboratories have standard practices in terms of biosafety and biosecurity. Our laboratory, as the level 4 lab in Canada, absolutely has the necessary procedures and protocols in place to ensure that any pathogen in our possession is handled, stored, manipulated, transported according to our biosafety and biosafety regulations and under the Human Pathogen Toxins Acts and regulations.
So what's your message then to the public? Because this is starting to take on a life of its own on social media.
Certainly, my recommendation is to consult our website, canada.gc.ca or /coronavirus, and the World Health Organization's website. The authorities in China also publishes information on a regular basis. So it is very important, and we also only go with verified information. That is really key. I know numbers go up, there's different data being available in all sorts of ways in the media, but we base on our public health actions on the collective global science data and verified information.
Okay, thank you.
Thank you. The next question is from Sharon Kirky with the National Post. La question suivante est de Sharon Kirky du National Post.
Great, thank you. It's a question for Dr. Tam. Dr. Tam, do we know what the reproductive RO is? There's been some modeling suggesting it's like on average 2.6, and if that's the case, potentially how many people might have been infected who were in this radius or area of this traveler?
The number that you mentioned, the basic reproductive number, actually changes also depending on your context and setting. That is some of the information coming out based on the data in China in that setting. It's not necessarily the same as in a plain contact tracing setting. So that's very key that when you mention that number, it means that on the ground in China, on the average, one person might be spreading to 2 others, which is not necessarily the same in different contexts. And so out of abundance of caution, we're doing this 2-meter radius because we know that is where the droplets might land, if you like, because most coronaviruses are spread in that way. And so I think that we need to just manage that particular situation based on the actual facts that we have about what we're trying to manage. So just to be careful about that number, because it could be different in a hospital setting, to a community setting, to a plain setting.
And my other follow-up, when this gentleman was taken to hospital by the paramedics, do you know if the emergency department had them isolated and separated? I mean, were they ready to go when that patient arrived? Because there is some concern we're hearing that among some nurses that they weren't alerted ahead of time that this patient was arriving.
So based on the information that we received from our local and provincial partners is that the patient did call ahead. And when they called the 911 and the paramedic services, they already told them about their travel history and illness, and all necessary precautions were taking place. And that upon arrival at the hospital, that the person was appropriately isolated and the infection prevention and control protocols were followed.
Okay, thank you.
Thank you. There are no further questions registered at this time. Nous n'avons pas de questions pour le moment. I would now like to turn the meeting back over to Matthew. J'aimerais maintenant retourner la parole à Matthew.
Thank you. That's it.
Thank you very much. Thank you, everybody.
Thank you. Merci. The conference is now ended. La conférence est